and Happy New Year, everybody. It's good to see you, and good morning, Los Angeles. Let me start first with just a moment of silence and a pause for the tragic news that we heard about the loss of a Los Angeles County firefighter. It reminds us every single day of the bravery of the men and women that are in the fire services, and our sister agency we work so closely with. And so I want to extend my condolences to the family, to the Los Angeles County Fire Department family, and Los Angeles County for the loss of a firefighter fighting a fire in Palos Verdes earlier this morning. Thank you. I'm here today with two extraordinary public safety leaders, our chiefs of our fire and our police department, Chief Ralph Terrazas and Chief Michael Moore, here at Fire Station 4 downtown, because I want to set Angelenos' minds at ease. We've lived through a stressful couple of years, every single day a new headline, whether it's Flu-Rona or whether it is on the number of people that are going to be there. It's very difficult for us to be able to move forward. We will address that, sir. This is a very stressful moment for Angelenos. So this is the 100th time that I've addressed the public. And since COVID-19 first came, I will, sir. It's certainly important for us to recognize how far we've come, but this is an incredibly tough moment, I know, for all of us in the city. The Omicron variant has taken off like wildfire. And in the last week, we've seen the highest single-day case numbers and the highest positivity rate, numbers that I'll go through in a second, before the pandemic began. Our 7-day average right now of new cases is 24,435. It's more than a 133% increase. So Omicron is spreading fast, and we're trying to save lives right now, and hopefully folks will allow us to be able to. We're feeling its impact everywhere as people test positive. Now, if you are infected, we now have a quarantine, asking people to quarantine for at least 5 days. You can leave quarantine if you have a negative test on or after day 5, and if you haven't had a fever for 24 hours and your symptoms are improving. This information is absolutely critical. I absolutely believe in everybody's right to free speech, but I hope folks will refocus here on what is important. The number of incidents that are out there, the lives that we are saving, and the work we must do to continue that forward. Without a test, you should quarantine for 10 days. That guidance is critical to our lives, the lives of everybody in this city. And these are important guidelines to follow the spread, to stop the spread, of contagion of what we know is the most easily spread variant of this virus that we have seen. That includes our police and our fire departments. So let me address both of those departments next. As of yesterday, 505 officers are at home quarantining after having gotten positive COVID-19 test results. For LAFD, that number is 299 employees that are out, both sworn and civilian, due to COVID-19. These are big numbers. Numbers that are reflecting the staffing challenges that all of us face, whether it's in the private sector, the public sector, and across all of our city departments, whether it's in our hospitals. And let me take a moment for our healthcare workers. I want to say that I see you, I visit with you, I've talked with you, and even though we're seeing, and we'll get to those numbers, fewer hospitalizations or shorter ones, we're seeing less ICU stays. I know how difficult this work is. I have family members who are there, as nurses. I have friends who work now around the clock making sure with the surge, and we want to thank you. From the folks who clean the hospitals to the folks who serve our patients, you are doing heroic work, and thank you for that. Our schools, our shops, our restaurant, our public transit workers who are driving the buses and making sure the trains are going. You continue to inspire us, and we continue to pursue policies to protect you. But I'm here today with a clear message when it comes to public safety. Both LAPD and LAFD have maintained staffing levels that are needed to keep Angelenos safe. Let me repeat that. We have maintained staffing levels to make sure you, your family, our communities are safe. And both departments are taking steps to ensure our city's public safety needs are being met while we ride out this storm. And I want to thank the heroes that we see that are showing up every single day. We are now in LAPD and LAFD, 5 out of 6 members of each of those departments are now fully vaccinated. Again, let me repeat that. 5 out of 6 of every police officer, every firefighter is in compliance, fully vaccinated with the mandate that we have in our city. Citywide, we think that number for all departments is at least 82%. So it may be that these two departments are higher than our citywide worker average right now. But in terms of our safety, I have authorized the use of additional overtime funds to cover those folks that are out sick. As of right now, I'm proud to say LAPD has been able to meet all patrol staffing requirements and had no disruption in its core services. Second, we're confident that the public safety needs of our residents will continue to be met without disruption. Our fire department, as I mentioned before, too, has experienced a reduction in staffing, but we are not closing any fire stations. So you can be rest assured the fire station that is by you, but when you call 911 for a medical emergency or, God forbid, a fire, will be there to answer that call. And I've made sure that the fire department has the necessary resources to provide coverage to our communities through overtime and other staffing adjustment. We've taken people in both departments who are working indoors. We're staffing them sometimes, whether it's patrol cars or here in our companies, to make sure you are safe. And additionally, the city's authorized funding for a 4th drill tower class of 60 recruits. And we're doing the same in the police department, where we just graduated our first class that was majority women. It was a historic class, and we're going to look forward to seeing more of those graduations. Now, let me add a very important point. Omicron is hitting everybody, both vaccinated and unvaccinated. But it makes a huge difference if you're vaccinated or boosted. We know Omicron is not as severe. That is the good news. We're seeing, and I'll share the numbers with you, hospitalizations have gone up dramatically, but they're nowhere near where they were at the peak a year ago. A year ago, we had more than 8,000 people hospitalized. 8,000 people were hospitalized last year. It's about 2,200 right now. And our ICU, we have about 130 people, where we had as many as 800 people just a year ago. So there's shorter hospital stays, and there are fewer people in the ICU. Last year at this time, 50% of the people in ICUs were there because of COVID-19. While it has doubled since last week from 5% to 10%, that means 90% of the people in our ICUs are not there because of COVID. That's encouraging news. But as I mentioned, our healthcare workers are stressed, our healthcare system is pulled, and so we know that those who are most vulnerable to being hospitalized, 3 factors: your age, your pre-existing condition, and whether you're vaccinated. You can't do anything about the first 2. Can't roll back your age. You can't help your pre-existing condition. The one thing you can do that is in your power is to get vaccinated. And to be fully vaccinated means now to be boosted as well. I got my booster just before the new year. As many of you know, I had COVID in November, so I had to wait a month. But it was easy, didn't feel much of anything, and I feel now that protection with this Omicron variant. So I encourage folks to go out there, get that booster, and if you haven't been vaccinated, get vaccinated. And to that small group that got 1 shot, go and get the second one as well. So this has something with milder symptoms, significantly lower chance of getting in the hospital. But for those who are still unvaccinated, let me be clear, you're 14 times more likely to be hospitalized without a vaccination. 15 times more likely to die, or somebody you love to die without that vaccine. So I want to close with a message you've heard from me many times before. If you haven't already, roll up your sleeve and get the shot. Get the vaccine. If you're eligible, get the booster. It's now recommended with Pfizer, just 5 months, not 6 months since your second shot, to get that booster. And if you got Johnson & Johnson, get the booster now. That's 2 months, they say, after is the recommended time. It's available to everybody 5 years and up. And as of this week, FDA has authorized booster shots for kids 12 and above as well. So now that is available. Don't put this off. This is your moment to get the shot. You can find the site nearest to you by going to coronavirus.lacity.org. If you're experiencing symptoms, you can order from the county. I know there's some questions about why the city's not doing this. The county, as our public health department, is authorized and has access to the at-home tests. These are at-home tests that you can go to covid19.lacounty.gov/home test in order to get that. And one final word before I turn the mic over, and then I'm happy to answer questions on anything, including some of the recent incidents that were mentioned, some of the work that we're doing in other areas too. But I know you've read about LA County's first Flurona case. It's a co-infection of both the flu and coronavirus caught here in West Los Angeles by one of our testers. Fortunately, the teenager who tested positive for Flurona does not have serious symptoms, is recovering at home. But this is an important reminder to also get the flu shot. If you haven't already, it's time to get that. To find a flu immunization near you, call your doctor, your local pharmacy, or you can also call the county's helpline at 211. Ask for locations where the flu vaccine is low cost or free. We're putting the emphasis in communities of color, low-income communities that don't have that access. We're also doing the same with our fire department, keeping our vaccination unit together with 68,000 PCR tests that we're trying to get out into those community groups that have been incredible partners. So I'll come back, talk about some of the other public safety concerns and other issues, but let me turn it over to the two chiefs, and then I'll come back and say words in Spanish as well. So first, let me start with Chief Moore. Chief Moore?
Thank you, Mayor. And the Los Angeles Police Department, our entire organization stands with LA Fire as we mourn the loss of this firefighter this morning. I appreciate the Mayor's leadership in calling for that moment of silence, of remembrance. I spoke with the Fire Chief this morning as well, offering him any support, any logistical needs that he might have. It's a tragic day here in Los Angeles for public safety and our first responders. As Mayor indicated, Los Angeles is safe. Sir, we'll address your concerns, but you can't disrupt this, okay? Thank you. We'll wait for him to be cleared. All right, so as the Mayor indicated, Los Angeles is safe. The efforts of our contingency planning to ensure that we have sufficient staffing so that our patrol units are available to handle not just emergency calls, but urgent and routine calls is present. We also have continued contingency plans. This morning I'm going to give you a bit of a rundown. The Mayor's giving many of these stats of our situation, but our efforts to mitigate the impact of this deadly virus, both on our workforce as well as the public, as well as our efforts to continue that the impact on operations is minimized. Not that it's eliminated. It can't be. But it can be minimized, and it will be by the efforts of a great organization that has seen tragedies and circumstances in the past that's challenged the staffing of this great city. So we have seen a 5-fold increase in COVID-positive cases this last week, just as the county and just as this region has seen an explosive growth with the coronavirus and this current variant. Los Angeles, as an example, this last week, 424 of our members, primarily sworn members, because we are the bulk of our organization is sworn, came down with this virus. That number was 82 the week before. And as we look across time, we also see that the increase of those positive corona tests have resulted in increased quarantine numbers. As Mayor indicated, 505 of our workforce are at home right now recovering. I'm grateful that only one is currently hospitalized, but his condition is extremely grave. As their members are at home recovering, our average time is about 3 weeks for them to recover and be back at work. Again, when we look back 4 weeks ago, we had under 100 of our membership that was impacted by this COVID positive and were quarantined. As we move forward, we recognize that our efforts to mitigate and protect the public requires us to have a fully vaccinated workforce, as well as to ensure that not just the public are supported and protected, but our members are. We continue our mobile vaccination process. Our access to that by the benefit of LA Fire. Last week, more than 200 additional shots were provided that gave additional protections. Not just those first and second shots, but the booster shots, as the Mayor has indicated, is needed for our continued protection. Our requirements for face coverings and other protective measures include workplace hygiene and ensuring that our members have protective gloves. And as well as we see individual areas of outbreaks where we're isolating to protect other workforce members as well as the public. This occurred just this last week with our academy operations, where we have nearly 300 recruits, all fully vaccinated, but the breakthroughs occur. And as that occurred, we saw, so a little bit of distractions today, but as that occurred, we saw a number of our academy recruits that came down with COVID. So we shut down our academy operations, having our academy recruits learn from home, remote learning. Now, this is a temporary and urgent matter. We've worked with our California Post representatives to ensure that we remain compliant with training standards. But it is a setback, but it allows us to protect the entire Academy training staff and others from this outbreak. We'll continue to make those type of adjustments moving forward. Our jail operations have shut down on 3 different locations on various times over the last week because we've seen an outbreak with individuals that we brought into custody or members of our workforce that have been tested positive. So our contingency plans have not just an effort to fully vaccinate our workforce and to ensure that we have face coverings and protective measures, but to also adjust operations as necessary so that the core services of our work remain. And that will be our continued move forward. Our continued response time, we will see some delay in routine calls. But as I bring to a close, I want to stress to Angelenos that 911 services are up. Our workforce on 911 operators are there at our 2 centers. We are, by the support of the mayor's office, staffing additional seats there on an overtime basis to cover for the 61 individuals that are tested positive that are currently quarantined from our 911 resources. But this is a department that is demonstrating its ability to flex and move and adjust its resources of more than 12,000 of our people to meet the needs. And that will be our continued commitment moving forward. And again, to all Angelenos, get vaccinated. To all Angelenos, protect yourself, protect your family, and protect our community by recognizing that this virus continues and it continues to be a challenge to all of us. Thank you.
Thank you, Chief. You see, we stay focused no matter what the noise is around us. So please welcome next Chief Ralph Terrazas, who's been doing a great job with our firefighters to make sure that those 911 calls, so go through a little bit of the stats of what that response time looks like, what that staffing is like, but to rest assured to know that those stations are all open and that coverage is all there. Chief Terrazas.
Thank you, Mayor. Good morning, everyone. And Mayor, thank you, and Chief Moore, thank you for recognizing our fallen LA County firefighter. When we lose a firefighter in the fire service, it affects us all. I've been in communication with Chief Maroney, the head of the LA County Fire Department, and we are supporting their needs. Every day when a firefighter leaves home and they hug their wife and their kids, it's with the knowledge that they may not come home or they may be seriously injured. And throughout your career, you get dispatched to emergencies, and occasionally you recognize that this incident is very dangerous. And you say a silent prayer to yourself, and you continue doing what you do, what you took an oath to do, to protect the people of this city. And today's fatality, today's loss is a reminder that life is fragile and firefighters' lives are fragile. So thank you for taking a moment, Mayor and Chief, to recognize our fallen county firefighter. We will be participating in the procession from the hospital to the coroner and other things throughout the coming days. Now, get to the topic at hand. Since the start of the pandemic in March of 2020, our firefighters have been on the front lines of COVID-19. This close exposure to the virus has resulted in a total of 1,475 members of our nearly 3,800 strong workforce testing positive for COVID. The post-holiday surge that we're seeing across the country has also hit the LAFD, with higher numbers of our firefighters testing positive. As of yesterday, we have 299 firefighters off duty due to the virus. It's the highest we've seen at any one time. Just a few weeks ago, we had 24 firefighters test positive. Yet the men and women of our department have a mission to protect the lives of the people of Los Angeles and come to work every day with that mission in mind. The LAFD maintains adequate daily staffing to ensure a sufficient number of ambulances and fire trucks are ready to respond at all times. We accomplish daily staffing with a combination of firefighters working their assigned 24-hour shifts, supplemented with firefighters who voluntarily work overtime, further supplemented by firefighters who are force hired, which we refer to as recall. Recalled firefighters are notified the morning that they're preparing to go home that they must continue to work. In spite of these staffing measures, in recent months, we've had to close for 24 hours some of our ambulances and fire engines. The number of closures fluctuates each day based upon the availability of firefighters and our daily threat assessment. But I want to be clear, company closures do not equate to fire station closures. At no point have communities had a closed fire station. What we do have are some fire stations with less resources than normal, but are still open. When you call for help from the LAFD, we will respond. However, our response times have been impacted by our lack of staffing due to COVID. A comparison of the department's response time data from 2020 to 2021 shows that for critical advanced life support responses, we have increased our response time by 13 seconds. And for structure fires, our response times have increased by 6 seconds. As we've always done, we will continue to evaluate on a daily basis our ability to maintain operational readiness to deal with any emergency that occurs within our city. Currently, 84.99% of our department is fully vaccinated. We will soon be implementing additional measures to maintain our daily staffing. These measures include canceling all approved leaves until further notice. With LA County Public Health approval, we will adopt a 7-day isolation protocol rather than the 10-day protocol that currently exists. We will begin mandatory wearing of KN95 and N95 face coverings rather than cloth coverings. We have also accelerated our firefighter recruit classes from 22 weeks to 14 weeks, and thanks to the mayor, we received approval for a fourth class of 60 recruits this fiscal year, which will give us a total of 235 new firefighters. The department will continue to encourage our firefighters to get vaccinated, boosted, tested, and to observe all department protocols in order to minimize the spread. I'm proud of the hard work and determination that we see every day from our firefighters, and I'm confident that it will persist as we continue dealing with this pandemic. Thank you very much.
Thank you to both of our superb chiefs for their work and for their command staffs and the men and women who are the rank and file of both these departments. I know how thinly spread you are, how little time you spent with family during the holidays, and how that continues, but you as always put our public safety first. Let me say a few words in Spanish and then happy to answer questions on this and, as I mentioned, anything else as well. Muy buenos días a todos. Y nos encontramos en un momento difícil para nuestro país. En la última semana hemos visto el mayor número de casos de COVID-19 en un solo día desde el comienzo de la pandemia. La variante Omicron se ha propagado rápidamente y a medida que las personas salgan positivo, deben ponerse en cuarentena durante al menos 5 días. Esto está creando problemas de personal en hospitales, escuelas, transporte público y más, incluyendo el sector de seguridad pública. Estoy aquí hoy con el jefe Michael Moore y el jefe Ralph Terrazas para asegurarles que los departamentos de los bomberos y de policía mantienen los niveles de personal necesarios para mantener nuestra seguridad. Estamos tomando los pasos adecuados para garantizar que las necesidades de seguridad pública de la ciudad continúan siendo satisfechas. La variante Omicron es altamente contagiosa, pero es menos severa si tiene las 2 vacunas primarias y la de refuerzo. Puede encontrar un sitio cerca a usted yendo a coronavirus.lacity.org. Muchísimas gracias. Lastly, I'll make a quick statement. I'm sure you'll have some questions. I'd like to answer questions first on this and then happy to answer anything else. But let me make a statement as well just to catch you up on the work we've done in the aftermath of the tragedy with Valentina Oriana Peralta. From the moment I was actually not far away from where the incident occurred, I was about a mile away. I've been laser focused on trying to make sure that we wrap our arms around this family, this horrific tragedy, as I talked about the day after. There are no words that will ever bring Valentina back. Life for her mother, for her family, will never be the same. As a father of a daughter, it's something that consumed my thoughts certainly over the break. I know for officers who went in thinking that they'd be saving lives, that the depth of that suffering that they feel too is unimaginable. But nothing is as bad as losing your daughter, losing a member of your family. I promised Valentina's mother and the family when I spoke with her two things: transparency and justice. We will have and do have 3 investigations, one led by our State Attorney General, one by our independent civilian oversight Inspector General, and that of the department itself. And as the Attorney General shared with me and others, LAPD is perhaps the best in the country in doing these investigations. That information 100% will be shared with both of those independent entities as well as the department. We will look comprehensively at everything from training to tactics, existing policies, and the incident itself, as well as what we've tried to do, focus services and whatever we can do for the family. Our crisis response team has been there every step of the way with them. Our Office of Immigrant Affairs, for any needs that they had that crossed borders. We're going to handle this continually with maximum transparency, sensitivity, and accountability. And this is something in which we will need to have outcomes that address what happened. I've learned not to prejudge those, but to make sure that they are transparent. And as I said, transparency and justice are both provided. En español también yo quiero decir unas palabras de Valentina Orellana Peralta. Es importante como la ciudad a tener 2 cosas: justicia y transparencia para la familia. Cuando yo hablé con la madre y la familia de Valentina, fue muy importante mantener este proceso de 3 investigaciones. Uno del Attorney General de California, Rob Bonta, uno del Inspector General del Departamento de Policía y un del Departamento de Policía también. Pero esta pérdida, esta tragedia es tanto triste. Como un padre me siento su dolor, y los servicios por la familia es mi enfoque. Los servicios de mi departamento y mi oficina de inmigración, mi oficina de ayuda para víctimas de crímenes, y la investigación será transparente y el resultado será justicia para la familia. With that, happy to answer questions. Thank you. Sure. Mm-hmm. Yeah. Not yet on capacity, though. The county, I was glad to see yesterday, or maybe they're voting on it today, adopted what LA City had already done to lower the levels of making sure that people are vaccinated, masked up, from indoor events from 1,000 to 500, and I think for the larger ones from 2,000 to 1,000 outdoor. I think that's really important. We are at a different point. If the evidence is the same in South Africa and the UK here, we will see this surge peak maybe as early as the end of this week or mid next week. And it should come down pretty rapidly as well. And as we're seeing with hospitalizations, again, not in any way minimizing how stressful it is to be a healthcare worker, it is a radically different moment with, a small percentage of the hospitalizations and certainly ICU hospitalizations as a result. So I think we can get through this quickly. I know the Super Bowl everybody talked about. I'm confident that will happen here and that we'll be able to have a great Super Bowl celebration. There's no evidence that shows us anywhere else in the world that's gone earlier that this is something that lasts for months. So. Let me go 1, 2. Okay, yeah, go ahead. Mm-hmm. I asked that same thing. We don't have those numbers. I think the majority are people who were vaccinated, which underscores how important it is to get boosted, and makes me reassured that we're not going to see, as we have seen, deaths from those who are at least vaccinated. The unvaccinated are at a much higher risk. If the statistics bear out, it's probably a much higher percentage of our personnel who are unvaccinated who are getting Omicron than those who are vaccinated. We know it's not 100% keeping you from getting sick, but it's likely to keep you from getting sick, and if you do get sick, obviously to keep you from being hospitalized and or from death. So we don't have those kind of numbers broken out yet, but we know that it should be the same as the population at large. If you're unvaccinated, it's burning through the unvaccinated population with much greater severity and much higher numbers than the percentage among those who are vaccinated. Yes, sir. I think our chiefs will know the stats a little bit more. I know this. Citywide, we have 278 workers, not just in these departments, full-time, and 2,509 that have been placed on leave. The vast majority of those part-time, by the way, are seasonal workers with Rec and Park, so that may be a communication issue that we're trying to track them down, and we don't always talk to them all year long. But do either of you have the numbers? So why don't we start with Chief Moore?
So I'll give you broad numbers. There are about just over 2,000 that have filed for a sincerely held religious belief accommodation. And the process that we have, Chief Terrazas and myself talk weekly. We talk frequently with Personnel Department as to the steps going forward, which currently are that we have all those exemptions have been filed with the department. We're now beginning the process, the interactive process with the employees of challenging the documents for their completeness and making a preliminary determination of whether or not they meet the necessary standard to be seen as an accommodation. Then that'll move to the Personnel Department, which has assembled subject matter experts for both the medical as well as the sincerely held religious belief accommodation, and they will look at our paperwork and make the determination of whether or not that meets the standards or not. The challenging process is that the forms that were adopted by the city, each general manager has presented those to each employee that indicated their desire to file for an exemption, whether it be medical or sincerely held religious belief, so that there's a standardization. So every department is asking the same questions, asking for the same documentation and rationale. The interactive process is a requirement of any accommodation process, which sits down with the employee and interactively back and forth asks questions to clarify information that's been provided, documentation that's been provided, or gaps in that documentation or rationale, so that the city has the best understanding of the employee's expressed request. Then we make that evaluation working with our police general counsel, which is the city attorney, and we'll make our preliminary determination of whether it meets those standards. These are standards that exist not just here in LA City, but exist as a country, as a nation. They tie back to civil rights acts and fair employment acts. So with that, the city has one center, though, so that all thousands of city employees that make these applications will have the same judgment, the same evaluation, and they'll make the determination of whether or not it's a yes or no, an up or down, taking in consideration our preliminary findings. So this will take some time.
Let me just get the numbers from Chief Terrazas real quick, and then we'll come back to you.
Yeah, we do talk regularly, myself and Chief Moore, but the numbers, we have for the fire department 374 exemptions as of yesterday request, and of that number, approximately 3/4 are for religious exemption, and the remainder are for medical exemption.
And one thing on the math you might have figured out, if you do the math on the percentage that's been vaccinated, that means that some of the people who've applied for exemptions have now been vaccinated. So in other words, I think, which I appreciate, that some people have, even though they put in an exemption, have made the good decision to get vaccinated. We probably don't have enough time here to go through it. We've worked for about 2 months on this. It's highly complex. We look at the precedent. It is a very difficult standard to reach. Not, in terms of our judgment, but in terms of getting an approval. And I think it's a very tight, narrow window in terms of the precedent that's been before Supreme Court and other places, and what we're seeing in other places where it's been challenged. So it doesn't require years of belief. The time period is not as important. You can come to religious belief today, but it has to be legitimate, and it has to be something which is defensible and not just somebody who, is turning out letters saying, hey, you want to be part of my church and we're against vaccines. Yeah. And I'll come back to you in a sec. Yeah, go ahead. Mm-hmm. I think we're confident, by the way, some people are at the end of that, so that it's not stacking up. You don't stay sick for 6 or 7 weeks. If they did, that would be the problem. But that 3-week period, I'll let the chief speak to it, but in our private conversations, we are confident.
So, Kevin, yes, the department and our contingency planning, we contingency plan for earthquakes, natural man-made disasters. For the pandemic, we have been planning for this potential eventuality since the early days. We still have resources that we have not flexed. We have not mobilized. As the fire department indicated, we, as fire service, police services, we have many parallels as to our operating standards. They have canceled days off. They have canceled leaves. We have not done that. We did in the initial days of the pandemic, for example, when we needed to mobilize this organization to provide for security and safety of shelters and other locations, we mobilized and canceled days off and leave. We've not, that lever is still before us. That would essentially double the size of the organization. These are short-term measures. I will not suggest to you that we would want to endure the current shortages of personnel for months on end. But as the mayor indicated, the behavior of this pandemic, of this particular variant, is that we do see this as a surge that will be, it is our hope and belief, short-lived. And to the public, what's critical is to know that if that were to change, that we'll be transparent about that, that we'll talk about it, that we want to recognize that, and we're not going to ignore that the real consequences that we see of this public health emergency. But with that, we also want to recognize that there are forces at play that want to optimize this situation for their own self-interest and selfish interests. And that's where it's important that the public's trust and our credibility is too vital for us to ignore and for us not to be here today to clarify and assure the public of where we stand and where they stand in the safety of this city.
Okay, let's go. Hold on one second. Take 10 minutes.
So on the first question, it is a mandate of this organization for all of our members to wear masks in and outdoors, whether they're vaccinated or not. And we have, and I'm well aware of individuals who have complained and made observations of officers not wearing masks as required. And we have investigated and taken corrective action, including discipline for those that have fallen below that standard. This variant that we're seeing today, I do not attribute to the lack of masks. I do, and we're watching very closely what the fire department is doing with county health as to elevating our current standard, which allows for a cloth mask, and moving to an N95 standard. We'll also look to what other ways can we mitigate this highly contagious variant from our day-to-day operations. Another example of that is our desk operations. We have restored some of our operations. This pandemic has not been a straight line. It's ebbed and flowed, and we've adjusted as a society, and our department will continue to do everything we can to minimize the risk to the public and to minimize the risk to our people. As the chief indicated from the fire department, the thousands of his members that have been impacted, we've had 3,700 of our membership plus that have come down with COVID. 11 of our people we have lost. We take this extremely serious. 4 of our spouses have been lost to COVID as a direct result of them being a family member of a police officer who has remained at work during this pandemic and will remain. So we are doing everything we can to safeguard them while also recognizing this is a people business. We're out to protect and serve, and that requires us to come in contact with individuals, many of them which are unvaccinated, many of which are impacted and are currently suffering from COVID. Secondly, regarding the tragic outcome of the Burlington department store and the loss of Valentina, as I said in the initial hours of that, we are profoundly sorry. This is a loss that cannot be measured as to its enormity. As a police professional, we are sworn to protect and to serve. There is no greater circumstance than to lose an innocent victim and to lose a child while we're trying to come to the aid of the very people in that store in this crisis moment where it is just unimaginable. And I feel for everyone that is in that store, for that family, as a father and as a police professional. It is something that sits in our mind every single day. And with that, though, we're not just dwelling on that aspect. We launched an immediate investigation into those circumstances, and I've promised and will commit to you a continued absolute transparency to the extent the law allows. Days after this event, we published the videos. We published radio calls. We published transmissions the officers received, body-worn video. And that is only one step. Not just the acknowledgement, as the mayor indicated, of this loss, but also the commitment to transparency. And then lastly, as recently as last night, I spoke with the chief law enforcement officer for the Attorney General's office, ensuring that they have full, unencumbered access to our investigation and to support their independent investigation. Mark Smith, the Office of Inspector General, same. And what I'm hearing from all sides is that the men and women who are in charge with this investigation have done exceedingly complete, thorough, and objective investigations that have complemented and supported the Office of Inspector General as well as the Attorney General. We are not passing any judgment on this, but everything is on the table for being looked at as to what not just what happened and the judgments and decisions that were made, but our policies and procedures and what we have as a standard for trying to protect and serve people in, at times, a very violent society.
Thank you. Thank you. You have the phone too, and then I'll get to you.
No, I'm suggesting that that in the public that there also are labor individuals who disagree with the vaccination standards and expectations of the workforce, and I believe that there are those who, again, this has been very much politicized, weaponized, and see these challenges as a result of this pandemic, and are trying to find an angle, if you will, of how to spin this as a negative decision. And this was a policy decision that I support, that I believe is going to protect us. And I believe years from now we'll look back and and reaffirm the need for us to socialize the importance of a vaccination to endure the challenges, the public health challenges we see with this pandemic, as health officials and the science has shown that this is not the last of it.
Sure. Couple things. We have kind of evolved our model together with the county of where testing happens. You see a lot of pop-up like tents around this county. The idea is to push it closer to where people are instead of longer waits in mega sites. Though we do have Dodger Stadium not in the massive sense open. We do have a testing site there. We have about 5 that the city is helping run. And there are literally dozens now through the county funding too that are in people's neighborhoods. And people always wonder, are these legit? They generally are. I mean, check to make sure, but they are ones, people are saying, how do they pay for it? It's free testing. They collect insurance information from those who are insured, and then that's how they make their money and get reimbursed. So it is a much more dispersed model. When folks say, well, why don't we do more centers? The problem isn't centers right now. The problem is test supply, and that's national. It's not just local. So, for instance, the 500 million tests that the President Biden announced, those have to be collected and distributed. Some of those have come with a priority to school districts that are then reopening for good reason. And I would say to folks who are frustrated with not being able to get a test, if you have symptoms, we already know what we're supposed to do. Stay home. So right now, stay home. We all are pushing to get more tests nationally, locally, statewide, and we'll try to, as I mentioned, there's the at-home ones that you can order now from the county directly as our public health authority. There are other ones, the 68,000. I don't know what we're down to now, but we had 68,000 about a week and a half ago, PCR tests that our fire department is sharing with our community groups, and really go to those local clinics, those community groups, drugstores, the pop-ups, wherever you can, if you feel you need to get tested. But I think a lot of people wanted to get tested during the holidays because of travel, or they wanted to go out on New Year's Eve, et cetera. So there was a real push. But if you're sick and you have symptoms, stay home. The test is less important. Whether it's flu or whether it's Omicron, COVID, you should be at home. You know the number of days you should be there. And then hopefully we'll have more of that supply coming in the coming days. There's 5, I believe. No, those are city sites through our partners like at the YMCA in the Valley, the Dodge Stadium, but they're run now by Core and Curative. We have 11 firefighters who are helping get the supplies there. We still have them overseeing the refrigerators. They're going into hard-to-reach populations. Some of our senior nursing facilities or people who are homebound, yes, they're doing that, but they're not the day-to-day staffing, and they never have been the bulk of the labor in any of those sites. That's mostly been done by the Core workers.
Okay, the question is, of the 299, how many do we include the people we send home leave no pay? The answer is we do not include them. The number as of yesterday was 41 are detailed home leave without pay. And we're processing our first Skelly case next week, and we anticipate a Board of Rights to follow shortly thereafter. Sure. The disciplinary process is it's in the charter, 1060 section. We have to have a Skelly hearing. There's 2 parts of that. We present the documentation on which we base the disciplinary action. The second part is that the involved firefighter is able to respond to that, and then the department makes a determination whether we should proceed to a Board of Rights. The Board of Rights is a panel of 3 chief officers who will hear the case and decide is the department desire to terminate, in this case, is it appropriate? That's what we're going to do in all these cases involving the condition of employment. It's really actually pretty simple. The question is going to be, are you vaccinated or not? And if the answer is no, then the board has only one conclusion to find. Well, the mandate's pretty clear. You have to comply with the mandate, and if you don't, we go down the condition of employment track, which ultimately leads to a Board of Rights, which will lead to termination. So those are 2 separate issues.
I think you're asking what's the logic, right, behind that? Like, what would you say to them? I would say this. I would say you're 15 times more likely to die. You're 14 times more likely to be hospitalized. And there's 3 reasons why we have this mandate. 1, to protect you and your family. I'm not going to bury another firefighter, bury another police officer or their spouse. 2, we interact with the public, including vulnerable populations, and we have an obligation to make sure we're not passing that on to them, hospitalizing and, God forbid, killing them. And 3rd, as this press conference shows, we need people in these stations and in our police divisions to protect the public. And this has shown just how bad this is. So I've never bought that logic. See, oh, the vaccine doesn't work, people are still getting it. Nobody's ever said any vaccine is 100% going to prevent you from being sick. It will minimize the chances of that, minimize the severity of it, and almost eliminate the chance of you dying from that. That's pretty crystal clear. Yeah. Sure. Yeah.
I think you're quoting those numbers from some of our firefighters who are resistant to the vaccine, and we've been tracking what they're putting out, and they're ballpark close. They're not exact. Now, the measures that I talked about earlier, I don't know how long that's going to take to have an effect, but I think we have to act sooner than later. We don't know where this spike is headed. And we're watching this every day, of course, and actually sometimes during the week it's every hour, because the numbers are changing in terms of people who come into compliance, people who apply for exemptions, and our staffing model. I spoke earlier of a daily threat assessment. We will hire more and recall more when we have the threat of brush fires, when we have high temperatures where we transport more people than we do normally. It's a constant scrutiny by us that happens right here at our dispatch center. So I'm confident by using the mechanisms we have been since the start of the pandemic, we'll maintain public safety.
So the Department of Operations runs regional jails, one in Van Nuys, one in downtown, and one in South Los Angeles. Those are 24/7 operations. Each of them have medical facilities there as we house those that are booked into custody for serious and lesser offenses. Those populations can range between 400 to 700 individuals that are in custody at one time. And individuals who are symptomatic are then tested. And those tests, whether it be an employee or a prisoner, a suspect, an individual, a person in custody, when those tests come back positive, we then, working with our occupational or occupational health and safety personnel, trigger hygiene requirements, which require us to shut or shutter that jail operations for a new intake until the work sites, if it's an employee, or cells and other areas in which the person in custody moved about are clean and sanitized to ensure that this virus and their walking and shedding particular virus elements is rendered safe. I can't tell you the breakdown between the two at this point, but I don't believe that it's employee-based. I believe it's because we're testing symptomatic people. 7 out of 10 arrestees are generally having and requiring medical treatment upon intake. That's one of the realities of the offender work that our people are engaged with every day, is that many of them are sick and ill and have various infections, diseases, and are carriers of COVID. And as they come into our custody for burglary, robbery, this morning we had arrests for some very serious violent offenses. Those individuals are oftentimes, just as we see in society, COVID positive, and that results in us having to isolate these facilities and ensure that they're safe for our employees as well as for the other that are in custody. As I said earlier, Kevin, let me say it again. I don't have the breakdown between the two. So it is critical that our members recognize, all of us, that this vaccine is our new world as a layer of protection for them, for their family, and for the public they serve. I'm proud of the fact that we have 84%. The mayor indicated 5 out of 6. It's percentages about that area. That has grown substantially from where we were just 2 months ago. Our members of our workforce are just like the communities in which we work and live and exist within. And there are those that are hesitant, those that are laggards, those that have beliefs that about this matter and that have shown their reluctance. But it is our hope that I'll not lose a single member. Yet I know that I have 11 members who are on a pathway to removal. 1 has already been fired, and 10 more are going through a Board of Rights process. That will, because of their failure to comply, that could expand with those exemptions that are not approved Should there be any, or those that we expect will not be approved, as the mayor indicated, these are stringent standards. The decision then will be on those employees to either be vaccinated or no longer meet the essential requirements of being a police officer or a member of this organization, a city employee, and their removal. It is my hope that not to lose these dedicated professionals with decades of experience, and in the sacrifices they're willing to make for the people of the city, that they recognize that this is part of that dedication and part of their commitment to this as a public safety employee.
We currently have, like I said earlier, about 42 people detailed at home leave without pay. They're on the path to, if they do not comply, they're on the path to aborted rights and ultimately termination. It's my hope, just like Chief Moore, that we don't lose a single person. You know, I don't want to lose a single firefighter. But the reality is, we want a fully vaccinated workforce. And it's my hope that that at the end of the day they come to that conclusion. But I have tremendous empathy, and I respect their position. Many of us grew up wanting to be firefighters since we were very young, and to give up the profession, you must have deep conviction. That's all I have to say on that. Any follow-up? Okay, thank you.
If there's no other questions, let me just thank IT. Sorry? Oh, yeah, go ahead. We'll make this last one, then we'll wrap up. Go ahead. Yeah, I'm very proud of what we did during the pandemic. I mean, we put in additional bike paths, additional bus-only lanes. This has been, and it's something that, if you remember, rewind the clock, I think it was the second or third executive directive that I ever did. This is not an individual sport. This is a team sport governing. And we have empowered, boosted budgets, expanded miles, and we're going to continue to. But it shows how tough it is. I always come back to, and I really think the victim is not just City Hall, it's this. It's the way, whether you're walking, people who bike, and certainly who drive, continuing to look at screens that we often see. But we're doing it with the 3 E's. We're engineering with literally hundreds of millions of dollars that weren't there, some from Measure M and other local return, to re-engineer those places. We figured out where the highest impact areas were, the first time the city's ever done that, to actually look at which intersections were the most dangerous. Second, through education. We continue to, and I speak out all the time. I do panels. I go out there internationally to kind of be part of this movement to make sure that we have more walkable, livable cities. And then third, enforcement. And we have funded that enforcement. We've changed the state laws to allow us to do the enforcement. But I am sympathetic with every advocate and every family, as we just saw tragically in northwest San Fernando Valley, who's lost somebody, whether it's a bicyclist, whether it's somebody who's in a car, whether it's a pedestrian. I hope that a warm baton will be handed to my successor, and they will continue that really wide expansion, regular talk about it, and the miles don't lie. What we did during the pandemic, we took advantage of people being at home. We striped a lot, we re-engineered, we changed car-only lanes to other things to allow that to happen. So, okay, very last, and then we got to wrap up. Oh, we don't know. We can't give you an exact, because they do take a lot of time. Everybody's short staffed, but we're putting the utmost attention on them. And then, as you heard from the Skelly hearings, they take by law, they take quite a bit of time. Yep. 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 I've authorized and encouraged the chief to have more officers doing that background check, as we've done in the past. Talked to the personnel department about co-accommodating. We already have police officers doing that, and this chief knows whatever resources he needs to do those will be in place to make sure that we get those done. Something we share. We have a weekly meeting on this specifically. No, I don't believe we have enough people on this at all. and we're looking to help the personnel department get more people, but as personnel department, like all businesses and government agencies, can't find a lot of employees right now, so we're actively recruiting there, also supplementing in the meantime with more officers there. Just a personal note, I want to thank, this was my 100th address on the COVID, even though we covered a couple of things. I just want to thank our information technology agency, Channel 35, for being there every step of the way. We did a lot of this indoors, and some of you as reporters would call in, but this was, we reached the centennial of our addresses, and I just want to personally thank all the team that's made this happen. Thanks, everybody. Happy New Year. Stay safe, and we'll see you soon.